Health Minister Kwabena Mintah Akandoh, Jesus Christ. Papa no say wa kan mean who obi a we so passionate. So the way we dwan the buafu say Ghana yesika pa say hey MPP never again.
2019 Ghana government signed an agreement with a company called Lightwave. Mr. Speaker, the contract sum was $100 million to connect 950 health facilities in the whole country. And the contract was supposed to expire in 2022. Mr. Speaker, in 2022, the contract was extended twice to expire on the 31st December 2024. Mr. Speaker, at the end of the 2024, out of the 950 facilities, only 450 had been connected. Out of the $100 million, $77 million had been paid. More than 77%. Meanwhile, less than 50% of the job had been done. Mr. Speaker, as part of the contract, it was supposed to be divided into what we call milestones. And so at the end of each milestone, the infrastructure and everything must be handed over to the states. Mr. Speaker, it is unconscionable for any government appointee to sign an electronic agreement that an individual will be hosting our data and the state will not have access to our data and the state will not have access to our service. Our health data. Mr. Speaker, this is what we inherited. Mr. Speaker, at the end of the 2024 when we took office, in 2025, the contract had expired. And so the issue of the government has come to terminate any contract doesn't arise, Mr. Speaker, because the contract actually expired on 31st December 2024. So there was no issue of termination. Mr. Speaker, when we took office, as part of the contract, we said, hand over whatever you have done to the state. And before we sit to take delivery of whatever has been done, we needed as a ministry, as a government, to know whatever we were inheriting. As a forensic audit was conducted, Mr. Speaker. Mr. Speaker, as part of the forensic audit, what we realized was that the software, the hardware, the infrastructure alone, there were gaps. For example, it was stated in the agreement that supply HP laptops. You go to the facilities and a different brand has been supplied. Supply 20 and you go to the grounds and less than 20 has been supplied. So there were issues of quality and there were issues of quantity. Gaps. Mr. Speaker, the gaps alone, when analyzed, was over $18 million for the hardware. That was the gaps. Mr. Speaker, it will interest you to know that in the next milestone, Ghana government paid more than $10 million to the vendor. And he was supposed to connect about 157 facilities. The Speaker, guess what? Only 7 was verified. 7. 1, 2, 3, 4, 5, 6, 7. Mr. Speaker, after all this, we said that, look, because we don't need any disruptions, we were ready to sign another agreement because there was no agreement, there was no contract. Because of the software, Mr. Speaker, it doesn't also make sense for the country's data, the software, to be owned by an individual.
And the Muda Honorable Ajimamanu Kafra, Mr. Ajimamanu, Papa said, "Way now ya on your honorable Bakubakusi. Yaguso Yaku COVID-19, Sputnik V vaccine no Yankuye. Sana the MPP for that to Onyas and Ketuanabi. Yet is a copiemu our various hospitals are. The National Health Insurance na na just say a good woman for year what. There's a beer come. Young what here first no could do as a cover folder. Over folder we are shas here. Yeah, today a friend was saying, your friend is a Ali Du Mahama, Fatau, yes, bo. What if you say near to na yeah. Near for the now amount, not a comma. Consult a consulting doctor no. Now consulting doctor so actually ya crowd we are in no the two. O you yourself a pharmacist wo. Now pharmacists no amount drugs Obeje this information we ni na. Ye dey come India company and they develop your software ni edi manages ha your records we ni na there time yesre pa ye mobo omangana ibe ye de obeje this all the health data wo Ghana so far say wo yare me yare wo AIDS me ogono we wo syphilis we wo diabetes we wo kidney liver cancer sa doc your friends the records ni na company now free India now develop sa platform na ma ye no company no data ni na o keep na de enye Ghana na keep Ghana need even full access to those data na almost omunya madwin kwasi data no almost dey maye na de ye bufu ya abofu no ewo mpa no say over $100 million dollars na ye ka say ye dey co develop this particular software ye say laptop ayen go to 20 ani ato 5 yen go to C ani ato 3 yen to keyboard ani ato 2 ye we sika so etwema nkrofo ya sika bosiri over 77 million ni ye twa de amount nkrofo na mbom no ube pie mu a adwuma no ma ye enuru 10% kra enuru 10% kra na way and a health minister Kwabena Mintah Akandoh on the floor of parliament unfortunately minority leader Alexander Afenyo Markins na nuko yi neka anu say me bu say health minister honorable Kwabena Mintah Akandoh say antiretroviral virus ya yerima HIV patients ya emma yare no ntoa so ngodu AC no ase nhunyan say yen huni suye de na ekọ my update.
That one he has assured us that very soon. What I want to know from my respected colleague is that are there plans to put infected people also on the antiretroviral drugs for free? Because by the time the symptoms show, the person would have gotten to the advanced stage. Mr. Speaker, I have done an exercise in Winneba because when the data came out, it was so alarming, and a lot of those who were infected were saved by Safu Kantanka's drugs.
Now when I health minister sorry I say motiwa na mo say health minister na John Dramani Mahama baye ya be cancel contracts na contract na ye cancel ye no ono say ye cancel contract bia ye cancel contract bia ni na de SCCA yi sika amadie dwiri mama bo Ghana any Ghana ye data ye health information ni na ko piem wo India go India individuals I say any ya na kuma any ya or sorry as we high blood pressure. I say how could you now you are Ralph Williams okay democracy hub for you eko pm wo rich for the phone send nurse ni bia attend to a patient in tentemunti wa video we no almost every person in Ghana said no obi o yare de yemfa camera ngosi ni zungotwa no na baby oda no oda o mere yom you are in your weakness. Enti eni kwan se enka ye video de babo ntinti de raf here no why bone amanfo kwole kura se yenchi no na enjeli no. Now the question is say yenchi raf na enjeli because say only one single hospital out of the many in Ghana here wako filmi eno kura no video na menu mienu ye hu yare fo mo da was how ya nhire hu omanimo we were all angry krom ha na ye ni na ye buafu o man we mu say hey like eni kwase sanyema we si yan kwankoti a health minister former ajimamanu oni na nado dan kwa akufo ado ne ba omia omutena ase yere ha ma manfo kwose contract ma contract na enam kakra o menya adie nti ko no o mu pa bontie ye data information ni na no omo de jama nkrofo no se mumfa na mumfa ye de mu amope enti na wo Ghana yi uso health insurance ngwa de a trust me you say hey India for any mo bibia na yare enti uti wona o sha say wunya message bi e phone nro bi hu akai oga de no e prompt you because yenim data yenim de how yenim yare bia o yare bia But some go for India for munya Ghana for or munya health professionals. Na health professionals nimpo almost swears out of secrecy say omuntimi emma bontin meka say we owogono we o ace ontimi nkwa bontin go kan but data na yasam yasori na dia kuma manfo sika no so yadi ne basa yase no enema asi etoso yanto we ama the health minister Kwabena Mintah Akandoh.
At this point, when we took over, we invited the vendor that the contract has expired and therefore they must hand over to the state. And so we needed to understand exactly what we were taking over. So a forensic audit was conducted. And when we realized was that even the hardware, there were gaps in the supply of the hardwares. The supply of computers. If, assuming in the contract is stated that they should supply HP laptops, you go and cheaper brands are supplied. They should supply, let's say 100, you go and less than 100 is supplied. So there were issues of quality of the equipment or material supplied, and there were issues of quantity, the number supplied. And so upon analysis, you realize that the gap alone for the hardware was not less than $18 million. Again, I have stated that the contract sum was $100 million. At the end of 31st December 2024, although 450 out of the 950 had been connected, the vendor had been paid about $77 million. Clearly, more than 70% of the total amount had been paid, and less than 50% of the work has been done. At that point, we had to refer everything to the AG and the appropriate quarters, including the security, for advice and appropriate action. As a ministry, what we had to concern ourselves with was a solution of the matter to get out this mess.
Now, and then our the government accountability series, the health minister Kwabena Mintah Akandoh, SBPM ne SHRemu, the akoso, the American system American was a friend Lightwave Health Information Management System, Lightwave Health Information Management System. That is a way no, a paperless. Just about me paperless ni biya nenke di koduro na minim di entia. Ghana have be a digitalization ko ebiano kronoko ho NSS National Service Scheme ya the digitalization bi koduro ye wie no ene krono ya bonkon over 2.2 billion Ghana cedis. Current Ghana cedis ya o nye old currency, new currency. Ya the digitalization ekopie mu wo health sector eno so obi akodisika. Ya the digitalization ekopie mu ewo kwan ya drones be for so ton edi ndura supplier and also among for diska chese baby digitalization will be an the thieves. Ghana ni who said as a one say nipa dodo na nse dan pe IT there. Krono no ma fa so omode bo tofu sa anomobo na sa Lightwave Health Information Management System according to the health minister Kwabena Mintah Akandoh chese enedre after forensic audit of the Lightwave Health Information Management System no were referred to Attorney General and Minister of Justice Dr. Dominic Akrutinga Ayini say pay to boase jimre pemre nenyamre fako hwensem we mu na sansem we de people must go to jail as a man for go jail ewo ho enti on accountability series government accountability series no according to health minister say no as a man for wura jail was an we mu na krono ne dream a yabo pa no enye krono keto na Lightwave Health Information Management System no ye de ba se nka ebeboa na store access patients medical records digitally ebe recording and manage outpatients and inpatient visits enti uremu upie ye take documentation ni na no digital ye for paper and bia ngotwere ebe track prescription laboratory results diagnosis and billing enti enura ye de ma ebe track mo say oh ye ma para biko yare no nkoye yensesa ne emfa ma ya adrofufuro laboratory results say koye lab test no ye wie no ye chese egono no wakodi aduane bone wate eno no ne record ne da ho ni na no some information ni na no the Lightwave complete ni na digitally da ma ya bra ye nkomano at the same time adro ye de ma wo kwa ye fa so sa yare ni na no diagnosis ni na no eno so ebe record ewie a sika ye agi wo ni na no ebe record am obi ntimi mo Ghana aban kro no ontimi mo hospital no kro no we nka perfect o hade ami kan mpacho boni bi wo de bi boni bi anim ebe facility referrals between health facilities timini say o yare e some municipal hospital some clinic na say ye referral per the data no e say etimi accumulate all hospitals e wo Ghana ha enti ye transfer free her to her and once you send data ndi amomo o medu ho no data no e available dada digitally enya afi na so kofa card fele ni din di say ye woni ye ben enya adwuma sa enka we perfect then so kwanum and at the end of the day it's about improving data sharing and efficiency within the Ghana Health 70 say your family Maxi Billian yenim de hame yenim me medical history simple and tietia we na nka eyade anka ye na bisa won say we eyeyi eba ne sen ana de ye wie ya ye say contractor ye ne nkrofo san ye adwuma mo nya nduru bebia ne atwe sika ni na awie sika so atwe wie ya emu de ye die enye sika ketoa ye say the who discrepancies sika chese o ma cause financial loss to the state abra mo to hardware niema o ma ton kwa according to the health minister Kwabena Mintah Akandoh say over $12 million Minister can say ote na ote the way o mo bona santa we mkra be $12 million a day.
What is the solution? The solution again is that out of the 950 health facilities, only 450 have been connected, and therefore we have an outstanding of about 500 health facilities. Going forward, we will open up for companies and players in the sector to bid, provided they meet the necessary requirement, so that we'll open it up and they will all go through the exchange, the middleware, so that in future we will not end at where we are at the moment. The plan going forward is that in the next 1 week we are going to begin with the teaching hospitals, the regional hospitals, and the highly populated district hospitals, to roll them over onto the system, the GHIMS. In the second week, we'll be looking at the rest of the district hospitals, and then in the third week, we'll be looking at the polyclinics, the health centers, and the CHIPs. In the fourth week, we'll do the mop-ups. So I am confidently announcing to the good people of this country that we have a 4 weeks plan that will get us out of this mess.
Yet yana si ya kwa mishafo omudi malaria duro aye friend say immune booster ne nkwa na baba aye HIV AIDS duro amuso mo test our clinic. Omo ye clinical test as we speak. Sana kantanka ye bia ma tima saman for yare o. We know this. We didn't propagate it. We didn't make it mass production. We didn't make sure say be fani means and ways. Na ye etimi da hwe na WHO no World Health Organization no se Ghana ni we no nefa no ben enti da bia mo twa approval from Mrofu yi nyansa ni ye ni bia na abrofu no ba na heba medicine ya no man but thank God the health minister Kwabena Mintah Akandoh say for now Ghana are you ready say obe paja herbal medicine emu obe improve herbal medicine o Ghana for acha say use herbal medicine enti nimdie bia na ye herbalist for no ehia no only mama me say masa ye herbalist for no the champion ones papa na ewo no there is both spiritual and herbal to heal and I also know hey ye no classroom this who follow back din na tia na ho na wo fa na o kire ngakra ha ben ye betima kire what you but complication ha ben bi wo ha unimpa esa itipa ye but da ba ko obi we ba ne na ya donsini ne sa do ne beka no na ho beto ne still intimini so omo fa ni means and ways true spiritual eyes omo di hu omo here lab test o here further and better test and say omo waduro and it was working. How then do we inculcate them? Say be make sure so ometimi aye herbal medicine. I've been preaching about this. God knows I've been preaching about herbal medicine. I believe, strongly believe, say most of our medical students, most of our doctors, nurses are just following the system. They are actually more classroom and one they know nothing outside classroom. The only based on experience, what they have learned in school, what they are seeing on the field. Asa. And the DNA a bit to improve herbal medicine. So there be HIV/AIDS adroi. So be will be na herbal medicine bit massa wasa. Mekai Dr. Sabi in South Africa. Yeah, my papa di we, but obewuno odi bi man se no we HIV/AIDS adru. Ye de ne call twene sa o we no ane se we di bem. Sa AIDS adru so am out. The pharmaceutical company, the big pharmaceutical companies are making money with us, the people. On found say broni and say bibini but before na say bi as de bia na pese adwin ko yeti as de bia pese ye yon se yedimi enti de bia na be ko so buye kwase asa but emena so se ehu de ye ne enim de ye betima de ye the truth of the matter is Ghana ye herbal medicine timi say yare mamu obi anfa propaganda ndada wo enti ye health minister eso eno ye hweso ye bedi hodwuma but the phenomenon kisu council say enye bad. Because HIV is a boys no. Any girls or maba. Omusuro nyin san chen eso. Obebu say gay mame me to condom maba o say wo de be den. Ah. Condom ya minu mi on ye be boy ho ban. Na tamu na ye fa okra na ye virgin. Na boy yi onimu ma pay. Na mu mienu I love you, I miss you. And a patutu. Na hello, how are you? They say you two cylinder. I call me ni we pa gaby. Show me mama to I call nyom. Two cylinder, wire cylinder voice. Enemy voice. You know me two cylinder nyom. Eddie Magay said be a bit my relax. Ranyagopon. Tito do the nede. Sata numpo HIV any ace. Na dia kwanyaba. Eni namyemu. Say mo de nimu namyemu na pepe. Na eneya. Bema baako. Ni boy bebre erige bebre ge baako ni boy bebre bema baako ni ge bebre eneyi se eneyi na unzuro HIV/AIDS ya use condom was want to ase mami or prefer pills so be abstaining from pregnancy than HIV/AIDS and jamai say ma so fu boy jamai politicians boy jamai and go nobody 12-13 but you tell them came out in papa and call me and I'm saying no one and call you no way jam so yo but then nay I call out 12-13 over the boy I papa be a 35-40 na say we na so I go so but still boys and per condom ni use HIV/AIDS ya ja ho asem ka among for close malaria ne HIV/AIDS how do we curb it how do we make sure say HIV/AIDS enkoso eme ya de be haye eno na Alexander Afenyo Markins esu eguza the health minister nemo no heat na honorable Kwabena Mintah Akandoh na wafa no Allah wallahi na ye dey heat what na me feel heat no but akwa no ne pass no and where the next president no na me sha say me de mani be se ne so wei nipa tietia ni abufu wei nipa tietia de na oni mpa se wodi bem wallahi obebre but Kwabena Mintah Akandoh bibia fine wakasa ye wakasa ma na efe but the good thing is yes you very fair one now making sure say our contract no about India for instance one the entire data akodi private people's entire Ghana ni now your entire medical data akodi private people in India not even in Ghana meanwhile your friends are software developers me nua friends say software developer ni company Alien Tech kakama obeya de no kama amamo mo nanam India for security me ba for power Ghana ha e bom develop software mo at the same time sika 100 million no mo metrexe mu kwa mo fa so di ma sika ne san ya aduma ya de ma Lightwave we o manti manye but according to the health minister Ghana will be creating a new software and no any private person but government and as Ghana and a building. Now why shouldn't we have now this was something what we are supposed to do. Now they were Kenya simple. Who represented Ghana and negotiate in favor of Ghana and making sure that Ghana will benefit. Meanwhile the data belongs Chasa krono no obabo na onyansa yakituwa bi o. Obabo krono a na onyansa na ayekiti. But for God and country, we a naked truth our old Boga trends. Edino ba ko number 1 Maxi Billian. Subscribe, like it, let's say we are for comment no to comment section na say gadindin gadam health Minister Kwabena Mintah Akandoh wapala ni koko were drag off because the former health minister ni Nana Addo Akufo-Addo anybody esika no badi adwuma no o ma say no anye yi